Doctor, what are the benefits of a laparoscopy as well as a laparotomy? Well, the division of adhesions can improve associated long-term, that is, chronic abdominal pain. Doctor, is that in more than 80% of people? Yes, it is. Those are affected? Yes, they are. It can also improve by 40% to 60% the chance of successful conception where the ovaries and fallopian tubes are entangled. Doctor, what are the risks? As well as the general risks associated with surgery and general anesthesia, there are adhesions that require surgery, often reform as the corrective surgery itself can re-trigger their formation. Doctor, is that although a surgeon can take steps to reduce their formation? Yes, it is. Adhesions increase the risk of a surgeon accidentally puncturing the bowel during laparotomy by 21%. Are there any alternatives, doctor, to this procedure? Well, the adhesion-related symptoms often improve on their own using painkillers to avoid the need for surgery. If they can cause persistent or severe pain, however, they are associated with reduced fertility. And if they cause complications such as small bowel obstruction, then surgery is needed. The only way to remove or divide adhesions is surgical. Doctor, what can I do to prepare? Well, try to be as fit and healthy as possible. Eat a well-balanced diet and try to lose any excess weight if surgery is elective and you have time. Take regular exercise. If you smoke, do your darndest to stop smoking. Smoking is anathema to successful operations. Doctor, what if I don't have the operation? In that instance, if the surgery is not carried out when recommended by your surgeon, it is likely that you will experience a worsening of your symptomatology. In some cases, laparoscopy or laparotomy are vital to make or confirm the cause of abdominal symptoms, especially if they are due to adhesions. And doctor, what happens during the recovery period itself? Well, after laparotomy, include an intravenous infusion or drip bladder catheter, a drainage tube at the site of operation, a nasogastric tube through the nose to the stomach, and an oxygen source. You may have a pump that releases pain relief. That is, patient is controlled with analgesia when you need it. Most of these tubes are removed over the next 1 to 5 days. You can start eating and drinking as soon as you feel ready, unless your bowel was punctured and repaired, in which case you need to wait a few days until your bowel function returns to normal. Visible stitches or clips are removed from 7 to 12 days. Doctor, what about gentle mobilization, which is, I think, important to reduce the risk of deep vein thrombosis? Yes, you will be advised not to lift anything heavy or to carry out strenuous activities for at least the first 4 to 6 weeks after a laparotomy. Certainly, those activities have to be observed carefully, and if it is a shallow instance, don't address it. You should not drive until you are advised that you can do so by your doctor and insurance companies. Doctor, let me ask you this. This is usually an instance where you can perform an emergency stop without fear that your wound may become infected? That is correct. What is a transurethral resection of the prostate, doctor? That is commonly called a TURP and is an operation to clear the urinary tube. The urethral element that runs through the prostate gland is operated upon, and a surgeon inserts a narrow instrument through the end of the penis and pares away or destroys excess prostate tissue using a hot wire, microwave heat, or laser energy. Is it?
Okay.